Authorities say they're investigating a viral pneumonia outbreak, and there's speculation that it could be linked to a SARS virus that killed hundreds of people in 2003.
A mysterious pneumonia has gripped China, with scores hospitalized by the illness.
Chinese authorities first notified the World Health Organization on January 11th that they had discovered SARS-CoV-2 in the Hubei province. On January, came out with more investigations. There was no big threat, and there was no need to impose any travel restrictions on China. The next week saw cases appear from Thailand, Japan, all the way to Nepal and the USA. On January 22nd, the death toll in China was at 17 with more than 550 infections. And finally, on January 23rd, Wuhan was placed under quarantine. On January 30th, the WHO declared COVID-19 a global emergency.
For all of these reasons, I'm declaring a public health emergency of international concern over the global outbreak of novel coronavirus.
The sobering fact is that it took 19 days to go from 41 cases to more than 7,000, bringing us to today, March 22, 2020, a total of 306,000 cases, 13,000 deaths, and 86,000 recoveries in 181 countries.
110 countries have reported confirmed cases.
Well, the total deaths in the UK is...
Quelques semaines, notre pays fait face à la propagation d'un virus.
Have we been able to eradicate the virus despite our best efforts?
We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
Earlier this year, people were downplaying the seriousness of the virus, saying that it couldn't compare to the 2009 swine flu or even the seasonal flu. However, a couple of months down the line, its alarming rate of growth and its impact to everyday life are painting a very somber picture. If history is to be believed, this is far from over, and we're looking at least 1 year of getting it under control. In the Philippines, it seems like we have just begun.
Walo na po, mga kapuso, ang kumpirmadong positibo sa COVID-19.
The number of Filipinos testing positive for the coronavirus is rising by the day.
It recorded its second case of the disease and the country's first novel coronavirus-related death.
Community quarantine is hereby imposed in the entire of Metro Manila.
On January 30th, the Department of Health announced the first case in the country. On March 5 and 6, the fourth and fifth cases were confirmed. On March 16, that number rose to 142 cases, and then the next 2 days saw 50 more people added to that list. As of March 22, we have 380 confirmed cases. This is what makes the virus so frightening. Experts have said that the virus has a 2 to 14 days incubation period on average. This means that it can take as long as 14 days for you to show symptoms and finally realize that you're sick. 80% of these cases are considered mild. As we're still in the midst of it, there seems to be a new study coming out about its transmission every day. But it's safe to say that person-to-person contact is the main method of transmission.
Tonight, authorities confirm it is being spread from human to human.
But what does that actually mean? Well, if you're sitting next to someone who has the infection and suddenly he sneezes, coughs, or spits, they could potentially spray you with respiratory droplets that contain the virus. Unfortunately, these droplets can also be found on a hand before reaching out for a handshake, or on a surface that was touched. Not everyone is hit the same way by the disease. The most at risk being the elderly, people with a compromised immunity system, and anyone with prior health conditions. That being said, a lot of people can carry the virus, only have mild symptoms, and still infect other people, wreaking havoc and potentially infecting people at risk.
The most vulnerable population are those actually aged 50 and above. Their cases are much worse if they have comorbidities such as diabetes, hypertension, and as such. Also, those patients in the younger age groups who have comorbidities are also greatly affected.
This is why people have been wearing protective masks, hoarding alcohol, and washing their hands all the time. since it's seen as the first way to avoid getting the virus, washing your hands frequently for at least 20 seconds with soap, not touching your eyes, mouth, and nose with dirty hands, and covering your cough or droplets with a mask. Back to those numbers. Whatever official count is given at any point, you can be sure that the actual number of cases is much higher, since the only way to confirm if someone has COVID-19 is to test them. Meaning, if testing is slow, the number of confirmations will be as well. Unless mass testing is carried out, we will never truly know how many people are carrying the virus. Most experts are saying that you should take the number of cases you have in your country and multiply it by 10, unless mass testing is currently being done, to have a more realistic figure. Whatever number you find will then continue to grow exponentially every day. This will only get worse as the infection spread from Metro Manila to all the other provinces in the country where they might not be as well equipped.
It can reach that peak kung saan 75,000 ang pwedeng magkaroon ng infeksyon.
South Korea and Singapore focused on mass testing from the onset. Their number one priority was to test as many people as they could so that they could proceed to contact tracing, meaning identifying every person that potentially came in contact with someone who had the disease and testing them as well. This would then help their agencies identify hotspots, places where a high concentration of people had the virus, and control those areas as best they could, forcing the confirmed cases to go to the hospitals and placing persons under investigation in home quarantine. That's an ideal situation, but even with that, the infection continued spreading, but is now doing so at a slower rate.
Some of the patients have been coming in because of fever. Most of them have been having cough and colds for the past couple of days already, and some would go to the emergency room because of difficulty of breathing.
If you have the following symptoms, make sure to contact the proper authorities. While waiting for mass testing to be possible, the other option is a lockdown. And the Philippines is not the only place in the world where this is happening.
Officials have suspended public transport, outgoing flights have been cancelled and train services shut down.
Foreign travelers coming from the UK and Ireland have been banned from entering the United States.
Towns in northern Italy locked down, but unlike Asia, Europe has open borders.
A lockdown seems to be the most effective way, as proven in China, to flatten the curve. The curve people refer to is basically a graph that shows how exponential the rate of infection can be. If people are left to still go out to concerts, use public transport, or attend mass gatherings, and the country already has a high rate of infected people, then logically, more people will get infected. Take the example of Italy. They went from about 150 cases to 5,000 cases in only 2 weeks. Now, if you lessen the number of people in a certain location, tell them to stay away from each other, and then eventually seclude them, the virus will still spread. However, it'll do so at a much slower pace. This is called social distancing. Basically, staying away from other people and trying to stay home as much as possible.
Experts say social distancing is a way to prevent spreading COVID-19.
Maluwag ng supermarket pero hanggang cashier may distansya ang bawat customer.
Not only does this help reduce the rate of infection, but it also allows the hospitals that are currently being flooded with cases to be able to accommodate people and help them recover before being flooded with another wave of patients. The last thing we need is a choke point in the hospitals. Because the less people they can treat, the more people will be getting sick and not getting the proper treatment, possibly infecting other people and making the death toll rise. Because of the lack of beds in hospitals and the proper equipment to treat extreme cases of a particular kind of pneumonia, this is already starting to happen.
Some of the hospitals have been calling in donations for PPEs, and I think it's the best thing that the hospitals need right now because it's the most important gear a frontliner should have.
This is what flattening the curve is all about, and this buys time for people around the world to help patients recover and eventually try and find a vaccine or a proven method of treatment. Regardless of where you are, social distancing should be practiced as much as possible.
Avoid going actually in your homes.
As lockdowns and travel bans become the norm worldwide, from China to Spain, Italy, Germany, Paris to New York, there's more and more talk about the economic impact of this lockdown.
Do not travel abroad. do not go overseas.
In lockdown with us are G7 countries, basically some of the most developed in the world. Now, as the Philippines is a developing nation, this becomes even more burdensome. Not only are we at risk of higher infection rates because of living conditions in lower income communities, but since a majority of the population needs to work daily to be able to afford housing and food, stopping work completely will create even more hardships for them.
Utang-utang muna pag wala pong pambili. Kahit po sa mga pagkain na lang po, ganun po, yung mga relief.
Sanitation is also a luxury that isn't found in most urban poor areas in the metro, so the virus could spread in those communities even faster.
The lockdown was very abrupt, like the complete shutdown of public transport, and no one was really ready for it, creating a confusing wave of panic from March 11th onwards.
No choice, maglalakad na lang. Lalakad na lang kami. Bawi ng Kalamba.
Every day, the national government and LGUs are starting to come out with solutions to help workers with no pay, the casual workforce, and people who will not be able to afford the basics during this lockdown. There are even talks of a stimulus package.
The TAP will likewise go to rehabilitation for those displaced in their jobs, for example, due to this month-long suspension of mass transportation, suspension of work as well.
While waiting for longer-term solutions to be put in place by the national government, I think there is hope, and that's all of us. We should support our LGUs and communities in any way that we can.
Every day, the private sector is also starting to do its part. The private sector's involvement will hopefully avoid businesses having to close and in turn not being able to pay their employees, and just creating a vicious cycle that will take months, if not years, to recover from. If we stop the spread of the virus now, the economic impact will be less important. So what can you do? First, stop the spread of fake news and don't add to the noise. It might confuse people in this time of information fatigue. Only get your news from verified sources. Second, practice proper hygiene wherever you are. Clean your hands constantly and properly, avoid touching any unnecessary surfaces, use